If you have been using hormonal contraception or condoms reliably, you can have your implant inserted at any time. If you have not been using contraception or attending clinic for emergency contraception, a healthcare professional can discuss with you the option of quick starting the implant immediately at any time in your cycle. If the implant is put in during the first 5 days of your period, you will be protected against pregnancy immediately. If the implant is put in on any other day, you will not be protected against pregnancy for the first 7 days after it has been fitted, so you will need to abstain from sex or use additional method of contraception during this time. It only takes a few minutes for the implant to be fitted. The doctor or nurse will clean your arm first and will then give you a small local anaesthetic injection. When the skin is numb, they will insert the implant. A dressing is then applied, which needs to be kept clean and dry. After it has been fitted, the doctor or nurse will feel your arm to make sure that the implant is in position. With an implant fit, it is normal to have some bleeding and bruising at the insertion site. The bruising will resolve. Occasionally, women develop an infection after the insertion of an implant. If you develop any signs of infection, such as redness, swelling, tenderness or discharge around the site of the implant, you must see a healthcare professional as soon as possible, as you may require a course of antibiotics. With an implant, your periods will probably change. In some women, periods will stop altogether. Other women will have irregular bleeding. You may have light, infrequent bleeding, or occasionally prolonged bleeding. This bleeding is a nuisance but is not harmful. If you have prolonged or irregular bleeding, you may be able to have medication that can help control the bleeding. You may get hormonal side effects. This is more common when you first start using the implant, and usually side effects improve within a few months. The implant is a very effective form of contraception. Less than 1 woman in every 1,000 will get pregnant over 3 years of using the implant. Some medicines make the implant less effective. These are called enzyme-inducing drugs. If you are taking these medicines, it will be recommended that you use additional contraception or that you change your method of contraception. Always tell your doctor or nurse or pharmacist that you're using an implant if you're prescribed or buy any new medication. Very occasionally, an implant may inadvertently be inserted deeper than intended into the arm. This very occasionally may result in damage to a nerve or blood vessel within the arm. Very occasionally, an implant may break, and if you notice that your implant feels different or feels broken, or you are no longer able to feel your implant, you must see a healthcare professional as soon as possible. Healthcare professionals undertake specific training in the insertion and removal of implants and coils, which means that these risks are very low indeed.